Hello. Thank you for allowing me this time to present this presentation in support of adding the proposed service of paracentesis to the oncology urgent care service line here at the St. Francis Cancer Urgent Care Clinic. My name is Tamara Cornelius Wells, and I'm the urgent care provider here in the clinic who provides direct patient care to our cancer patients as they come through the clinic for various patient care reasons. And I also support the nursing staff for patients receiving transfusion and infusions. The proposal that I'm presenting today aims to present data that will help in consideration of implementation of the paracentesis procedure into the urgent care clinical workflow. The information presented is only foundational data that I hope will give leadership enough information to consider allowing this procedure to be performed in the Cancer Urgent Care Center for patients in need of peritoneal drainage of ascites fluid. We do have a area of growth that we can give to the clinic in this avenue, and we do have an opportunity for increased services, increased revenue, and productivity with implementation of the paracentesis procedure. So I hope that this presentation will give you the information that you need for consideration of this addition to our service line. A paracentesis is a procedure that utilizes ultrasound technology in order to place a catheter in a pocket of fluid in the abdomen for drainage of ascites fluid that has collected in the free spaces around the abdominal organs. This can be seen in oncology patients that have metastasis to the peritoneal area, as well as other etiologies that can cause this type of condition. And normally they will need this drained by placing a temporary catheter that goes into a pleuritic drainage procedure. I've been credentialed in this procedure by Dr. Mueller, Director of Radiology at St. Francis Interventional Radiology Department, who oversaw the training that I received for the procedure. We currently have ultrasound capability in the clinic, so this wouldn't be anything that we would need to order or have delivered. We already have that capability here in our clinic, and our procedure room is equipped and ready to add this procedure at any time. This procedure is not high risk. I feel comfortable that this procedure has a low risk for outpatient implementation. There are some risks, as in any invasive procedure has, bleeding and infection. But there's very low probability of this occurrence with proper training and evaluation of each patient, making sure that they are eligible for the procedure. Integrating the paracentesis procedure into the workflow of the urgent care and transfusion services can give patients another avenue for an outpatient venue to have this complete, and it has the potential to increase productivity and revenue for our current urgent care clinic while easing patient volume in other outpatient settings such as the West Cancer Center Radiology Center and emergency rooms that will need to perform on an emergent basis. To implement this procedure, there are some adherence to workflow that we would need to consider, which I hope this presentation will address for you. Now, what we would like it to achieve is the optimization of daily workflow in nursing staffing, increase in services of procedures that are offered, such as transfusions and infusions, among others, and clinic growth, which we are always looking to provide. The optimization depends on scheduling of nurses and consideration of the type of procedures that we will be performing in clinical workflow during our hours of 10 a.m. to 6 p.m. with adherence to understanding what responsibilities nursing has to each of these procedures, whether it's transfusion or infusion, whether it's paracentesis, whether it's anything else that we add, and understanding how that impacts the amount of work that we can do in the given allotted hours that we have. The following slides after this one will give a breakdown of specific staffing, productivity, and clinical workflow by weekday and hourly clinical scheduling. It does not include breakdown by product on the transfusion side or specific procedures. I guess it does on specific procedures, but we will visit those in the next 3 slides. Again, this information will give you the foundational background to start the conversation to consider possible implementation of the paracentesis procedure into our daily clinical workflow. The timeline of implementation will be up to leadership's determination. However, we hope to see forward movement within the next 2 to 3 months if possible, with understanding that these things take time to move through proper channels of approval. Now, although we do not have data of the financial ramifications, such as profit versus expenditure and concerns to adding this procedure, according to the data presented here in this presentation, it can be deduced that addition of services will increase revenue and patient services offered in the clinic. Our goals would be to optimize services offered in the clinic while working within clinical staff availability that we have currently, and maybe moving toward adding a swing nurse if implementation is approved, and looking at the revenue and the budgeting to gain more profitability understanding and additional services for sustainability of the clinic. The following slides in the presentation will reveal complete scenario breakdown of workflow by setting services and clinical production times that will give leadership the decision-making ability to decide on if the implementation of paracentesis is beneficial to us at this time in the current state of our clinic. The slides exhibit detailed breakdown based on nursing assignments, hourly production, and procedures offered. However, like I said before, this information does not have a breakdown by specific products offered, such as timing for individual infusion rates of packed red blood cells or platelets or iron infusion versus patient getting fluids, or any breakdown of urgent care specific reasons that the patient comes in as far as abdominal pain or febrile neutropenia. It doesn't break down in that aspect, but I think this can be looked into further if approved, and we can kind of build a production scheme around that. This is something that we can look to later on as we move forward with consideration of clinical workflow by product or procedure. This slide outlines basic clinical workflow by 2 nurse assignment by the hour with paracentesis availability. So if we had 2 nurses in the clinic on a given day, and we're saying that this can be like a Monday, Wednesday schedule, if we were considering paracentesis implementation on these days between the hours of 10 a.m. and 6 p.m. So as you can see, transfusion infusion can be considered during these hours with 2 paracentesis done on these days during the clinical workday based on hourly workflow. The proposed outline gives consideration for all possible transfusions, nursing lunch coverage, actual paracentesis procedure, timing, by hour, and the monitoring of recovery afterwards, and the discharge of the paracentesis patients as it fits into the clinical workday. Urgent care availability is seen on opposite nursing paracentesis responsibility hours during downtime in the midst of paracentesis procedures. So we will plan to incorporate our urgent care patients into transfusion paracentesis procedures. Sometimes they are waiting on labs or medications or fluids to finish or consideration of radiology. And so during these downtimes, we can definitely add into more productivity during those times. So on Monday and Friday, the breakdown will be nursing staff of 2 with transfusions of 4. Non-product based, we can go deeper into that as far as productivity, if we can increase based on product based, because I think that like iron infusions may not take as long as packed red blood cells, so we can look further into maybe increasing that number or having a certain amount of procedures on a given day. This can be something as we move forward that would be a goal of the team to recognize and kind of work out. So 2 paracentesis can be done on these days with an uncapped urgent care patient load, and usually our average is between 3 to 4 on a daily basis is what the goal of the UC, and we even want more as we move forward, but that's kind of what we have seen within the year that the clinic has been up and running. As we look forward to increasing this urgent care and transfusion productivity rates, these numbers will be further detailed based on given product and transfusion infusion to see if we have room for increase in the transfusion infusion department on any given day. So that's clinical. And the next slide, this slide outlines basic clinical workflow by 3 nurse assignment by the hour with paracentesis availability. And we kind of looked at it on a scale of a weekday, maybe Tuesday, Thursday. And because this includes a 3rd swing nurse, we don't have the ability to do that right now in clinic. So this will be a consideration of leadership on these particular days and how we can use this 3rd swing nurse and how it will benefit us. As you can see on Tuesday, Thursday schedule, if we were considering paracentesis implementation on these days between the hours of 10 a.m. and 6 p.m., then transfusion and infusion can be considered with 2 paracentesis done at the time based on hourly clinical workflow. And we would do it based, as previously stated, during the downtimes, we would include our urgent care patients. This proposed outline also gives consideration for, again, nurse lunch coverage, actual paracentesis procedure, and the monitoring of recovery afterwards, and the discharge of the paracentesis patient. The workflow gives consideration to the use, the availability of like urgent care patients during downtime in the midst of paracentesis procedures, and the use of a 3rd swing nurse to pick up like typing screens for next day transfusions, along with availability for this nurse to also do transfusion infusions on that day, and provide lunch coverage for nurse 1 and 2, who will have the responsibilities of paracentesis within their clinical workflow. So on Tuesday and Thursday, given the staff availability and the breakdown, will be a nursing staff of 3 with 6 transfusions, infusion procedures, so that increases the growth in that area, and 2 paracentesis with type and screens for the next day scattered throughout so that they can also get those in, with urgent care patient availability uncapped, but still at an average of 3 to 4 patients during the times that we have to service those patients. And I think we can do that well, since we have been doing that now with transfusion infusions. We kind of fit those patients in as they come in, and we see what they need. I know, again, that this utilizes a 3rd swing nurse that is not actively implemented into our current clinical staffing, but this outline gives a good foundational basis of if the third swing nurse was to be approved and how they will be utilized in like our clinical workflow and how this will improve our productivity rates. The last productivity slide deals with the clinical workflow by 2 nurse assignment without paracentesis procedures. So I guess this would be kind of what we see normally now in our clinic. And on Friday scheduling, which was particularly looked at usage of no paracentesis on Fridays due to the fact that we do see an increase or a spike in urgent care patients as we go into weekend constraints. So consideration for optimizing transfusion infusions on this day with provider support would be a strong recommendation and a goal for this particular work day clinical flow. On Fridays, there would be 6 transfusion infusion procedures, not broken down by product again, but we can revisit again product breakdown detail at a later time as we move forward with dissecting clinical workflow and productivity. So in conclusion, on Friday, 2 nurses will be staffed and cross cover for lunches for each other and 6 transfusion infusions with uncapped urgent care, usually at an average of 3 to 4 patients a day, and no paracentesis procedures performed to have the provider focus on urgent care for the entirety of this day, because we see a spike in need of patients that are maybe having more difficulty going into the weekend, and we're trying to support them in admission and discharge decisions and talking to their primary oncologist. So a lot goes into that. We can increase production and focus on urgent care for this particular day without paracentesis offering. So in conclusion, and to recap and kind of put everything into a complete data formation, this slide conveys the compiled data from the last 3 slides that gives a breakdown of nurse staff procedures and transfusions infusions on any given workday based on the clinical workflow and production that we looked at. It reiterates the decisions that we have had on previous slides. The breakdown can be used kind of to tweak and change the clinical workflow and to give a basis of a generalized breakdown of what would be seen on weekday production status. And as you can see, it just kind of gives a 1-slide picture of all those detailed hourly clinical workflow that we previously discussed. Understanding patient care productivity and the business model of the outpatient urgent care clinic can give a clear stance on goals and give you as leadership the information that's needed for further implementation of services. Again, we can increase revenue while still focusing on quality patient care and increasing our service line to offer great outpatient services to our patients, which is a huge focus on keeping them out of the hospital and creating services that will give them the ability to come and get procedures and leave and go home. It aligns with reaching one of the UC clinical goals of allowing the patient to receive care while having the quality of life outside of just hospitalization. The basis of the data can also lead to further implications of building hourly clinical flow around weekends, if that's possible, if that ever comes into fruition, and after hour care availability, which could be lucrative as far as profitability to the clinic and meeting a need that is seen in the patients as we move forward. Now, the weekends and after-hour ventures are by no means something that will be looked at here in this presentation, and I'm sure will take a while to become a reality for us, because that would need further staffing, further clinical workflow considerations, and things of that nature. But I think that it will be something that is a good focus as we move forward in laying the groundwork and continued growth of the clinic in the realm of services and adequate production for profitability and increased quality patient care services. It is exciting to think that just a year ago we were at ground zero with this particular service line, and now we're talking about increasing services and the success of the clinic and how it affects, patient care and clinical workflow. It's really exciting to be on the cusp of increasing and growth in this area. So thank you for your time and your consideration of this proposal. I want to thank Courtney Jones, who is the lead RN in our clinic, for her intellectual contribution to this presentation, for her understanding of nursing staffing versus the procedures that are done, and the responsibility of nurses in the clinic and how that fits into the clinical workflow. Thank you so much for your work in that area and offering your understanding, and for working diligently with me to get a base outline of the clinical workflow and, like I said, all the nursing responsibilities of the procedures that are performed in the clinic, and your contribution to this presentation. I'm more than happy to discuss any questions that may arise after reviewing this presentation. Please feel free to reach out to me at the email presented on the slide. And also you can call the main number of the Cancer Urgent Care Clinic at St. Francis Hospital Park at 901-765-1930. Another avenue to reach me is my provider line at 901-864-7114. And if you just remember the main clinic number at 901-765-1930, the young ladies at the front will be more than happy to give you the provider who is on call for that day, or you can reach out to me on my specific provider line. Thank you for your time. I hope you have a wonderful evening, and I hope this presentation gives you the information you need to properly consider this procedure included into our service line. Thank you so much.